painted with colors of life, resilience, and a burning hope for a brighter future. For years, healthcare was a delicate thread in this tapestry, a distant horizon shrouded by harsh realities of affordability and inaccessibility. But in 2019, a new thread emerged, woven with solidarity and strength: Marwa Kisumu Solidarity Health Cover. Marwa, meaning ours in Luo, became a beacon of hope, a promise etched in the Kisumu County Health Act. Its aim to ensure accessible, affordable healthcare for all, especially the most vulnerable. This wasn't just a health scheme, it was a movement, a community rising to say no one gets behind when it comes to healthcare. Marwa, in its initial phase, embraced 45,000 vulnerable households, granting them access to NHIF super cover benefits at selected public facilities. The county government, alongside partners like Farm Access Foundation, became the bedrock of this support, subsidizing premiums for those who could not afford them.
Marwa has been running for the last 3 years and we've had market success. Initially, when we started Marwa scheme, only 8% of the people in Kisumu were insured. But after running it for the first and second year, we ended up increasing this number from the initial 8% and doubling it to 16 to 20%.
But Marwa wasn't just about access, it was about quality. The scheme spurred improvement in health facilities, from equipment upgrades to staff training. It fostered collaborations between the county government, NHIF, and technical partners, creating a cohesive ecosystem for better care.
Ne achandora kabisa kanya radio operation Nakuru. Ne school to gochna ni utuo. Kuro tuo to kadhi kuno to ne Nairobi mokwongo. Askando ka oro men yodhi kuno ne wanka kata gimora mora dala. To operation wach nitere operation daktari pimo wach nitere operation ndio ani mondo michake gi siling 70,000 man watero ka gimora mora pok watimo. Kolo kodi operation for only 2 days. So miswa kawuono 2 days of the operation. Ne wabedo gi shida kabisa ko gochno ka wandala. E account na nangi only 30,000 idoro 70. Ne angi NHIF to ne na dongi go wi ne poka chudo for 2 months. Kolo kana dhi kuno to misa ni ogenyal cover nyaka tieko gowi. Kaseti gowi cha ka 3 days ka koro gino beda ka account na beda active. Koro ne awinjo ka neno mateka ahinya. Alafu nochuna madhi akawo jamni mane an godo. Asintie mchele mana keto stock kaka ngama jopur na keto mchele moko stock na biro nyiewo seche ma school fees mag nyithindo go jopo. Nochuna maja kadhi nyiewo mchele go marius 110,000 on top of 70,000 manotimo logistics kigole Nairobi kitere.
With Marwa, the fear transformed into relief. Simon, a fisherman, echoes this sentiment. Marwa gave me back the power to focus on my work, knowing my family is safe.
Apiko nonyono kidumu agore pint. Mature tienda ka mochol. Joma nwa no temo tiela rasha ka. Na neno daktari kachopo dhiambo na beda admit ni nyaka donje ward. No wacho mondo nyiew chuma, welo na nyiew chuma moro mondo rwake tiendo riego tienda no mondi. Maro no nyiew na chuma no bimo rwak na tienda. Rore. Anyalo hinga 70,000 ka dimbe. Abed godo ready maka tiendo so rie. Libero yang tirwako chuma na titwe go chogo. Maro no timo na mondo dwara chuma. With Marwa,
the thorns of worry turned into pestles of relief. Now, sickness does not mean hardship, he says.
Nyathina mane chanda inyagi weche mag tuoche mag skin disease amor nikech sasa anyalo neno daktari kendo anyalo tere hospital kendo anyalo timne thieth e yo makare, anyalo tere lab kendo anyalo ndikna yedhe.
But Marwa's journey wasn't without challenges, reaching the most remote communities, educating them about the scheme, and ensuring sustainability were hurdles requiring constant innovation and community engagement. Through town hall meetings, radio broadcasts, and even door-to-door campaigns, Marwa built bridges of understanding, ensuring no one was left in the dark.
Formal sector were actually not registering. And so we started to look at why is it that they don't want? Is it that they don't have money or they just don't want to register? And so through several interrogations and speaking to community members, what we realized is that the strategy was not right for the informal sector.
And now, Marwa evolves, enters Marwa Plus.
We needed to be a bridge between the people in the ground and the insurance. And so what we wanted to do was become what we call the aggregator for the informal sector.
To achieve 70% health insurance penetration in Kisumu and effectively finance the healthcare system, the program is working towards gaining traction in the informal sector, targeting organized groups and self-paying members. For example, market vendors, Juakali traders, cooperative circles, among others.
Ni kitu nzuri kwa sababu mara mingi si watu bodaboda, mara mingi wanapata ajali, mara mingi unapata labda wakati unaendesha pikipiki, hiyo upepo mara mingi una affect kifua. Na mara mingi ni kitu inakuja na kushika wakati ujitarajia, kwenye sio kitu inabisha hodi. Ile kitu unashika mara moja ushagonjeka kwenda hospitalini. Na ukishaenda hospitalini gharama ya maisha sasa ni maisha ngumu. Yenye huwezi kujimudu kama huwezi pata msaada kutoka mahali popote. Mimi upande wangu ningependa kuwahimiza watu wa bodaboda, hii kitu ya Marwa ni kitu mzuri. Inaweza tusaidia hapo mbeleni.
There are some vulnerable women. They cannot afford even 200 shillings per day. But they can come out with an initiative. Educator wa mama, watoe even if it is 100 ama 10 bob per day. So that they can, at the end of the day, they collect something and they pay for the NHIF.
When the women come to trade, they trade every day and they have to pay their fees every day. We were going to add an additional fee for them to be able to get the insurance cover. So that instead of paying the 30 shillings that they come for the market every day for their space to work in, they pay 50 shillings. So the extra 20 shillings comes as part of your insurance package. Marwa is going to be more interactive with the population. We are going to have online platforms. One of the things we're going to do is we're going to have a website for you to be able to register yourself. Whether you're in London, whether you're in the UK and you want to register your mother, you should be able to do that. You should also be able to pay into a wallet or to pay this money in a more convenient. We will link you to the nearest community health worker, and community health workers are really going to be our agents. So that community health worker can come to your house and do final registration. We are going to be the bridge between the social health insurance, because we prefer to work with the government insurance, because then we contribute towards the national pool. When we have a national pool, then we have better outcomes, all of us as a country. That we want to have what we call performance-based incentive for the community health workers. So we want our community health workers within the community, you need to be able to know what percentage of your people are insured. So then we will give you an incentive that if you can increase this percentage from this percent to that percent, then this incentive will come up along the way.
Marwa tuweke wanani iwe kitu ya maana, tunaona kama kitu yetu.
Lorraine Anyango, Kisumu County.
So in belonging, let's secure and protect affordable, accessible, quality health